and organization in the chat. And also, please note that this meeting is being recorded. And so, as we have a pack agenda, and so again, we started. I'm going to review the agenda, and Shanae and AJ will take over. So we will start with regrounding the problem statement, evidence, and strategic focus. We've been working on the CHIP, strategy development plan. And so we review the data and then we actually identify the problem statement. And so just want to mention the problem statement again, and Shanae will go into more details. So just to recap, for our problem statement, we identified health literacy challenges, made it difficult for residents to navigate available services and resources. And then we continued through this process, discussed the root causes, and also selected a starting point. And so our starting point was to clear centralized health information, ensure residents can easily find and understand information about services and benefits. And so we reviewed the action plan. We came up with the goals. There were several goals, so we decided to start with the first important one. And then after that, we also discussed like objectives and who's responsible and who's going to be responsible for the lead of these objectives and working together as a team. And so our first goal was to increase access to clear, centralized, and culturally responsive health information. And so we'll go through this information again. Shanae give like a high level overview and then go through the next steps. And then we'll have the final review of the action plan. Then we'll have community announcements from AJ and then upcoming meeting and adjournment for this May's meeting. So I'll turn it over to Shanae. And we
Awesome.
really just one more thing. Just thank you guys for all your input and really, because it's valuable. We didn't want to make the decisions. We definitely want to hear the input of the team. This is a team effort. So we hope you continue through this process as we finalize this activity. So thanks. I'll turn it over to Shanae.
Thanks, Farnisha. That was amazing. And you knocked out a couple slides for me, so I really appreciate that.
Oh, sorry not to take over your job.
No, please. As much as I love talking, I'm tired of it sometimes. So thank you for doing that. So thank you, Farnisha, for just regrounding us again in our problem statement and our data and the starting points and some of the common themes that we discussed as a group, which led us to that selected goal, which Tornisa shared, was to increase access to clear, centralized, and culturally responsive health information. And so at its core, this goal really just focuses on making it easier for our county residents to find and understand health information in one trusted place, one centralized place. So by promoting platforms like findhelp.org, we want to connect community members to that centralized, user-friendly, and multilingual resource hub that simplifies how people can learn about and access services. And so based on work group discussions and survey feedback, we drafted 2 proposed SMART objectives that were aimed at addressing this goal. And what you'll notice is that these objectives really center around increasing both that public engagement and awareness, and as well as that provider engagement, awareness, and participation to make findhelp.org a more widely used, more centralized hub for finding, accessing, and connecting to care. And so our objectives are on the slide, and I'll quickly read those for you. But by June 30th of 2029, so remember the CHIP is a 3-year process. It's a 3-year document. We want to improve awareness and use of Find Help as a centralized multilingual health information and navigation hub or platform among county residents through focused outreach in high need and underserved communities specifically. And then in that same time frame, we also want to increase the number of partner organizations in the county that are actively using Find Help as a shared resource and referral hub. And so throughout some of the conversations that we've had over the past month, I think one thing that came up pretty consistently, and that's in this work group as well as some of our other work groups, is that residents often either don't know where to go or don't know what resources to trust for accurate information regarding what services are available, or they're unsure of how to navigate those systems once they do identify a need that they have or a resource that they want to access. And so we also talked about how fragmented information, things like language barriers, digital literacy challenges, as well as inconsistent referral processes can make it harder for residents, especially those facing barriers, to connect to care and those supportive services. So a lot of the strategies that we discussed really center around improving awareness, strengthening that navigation support. We talked about increasing coordination across partners and then creating a more consistent pathway to information and services. And so I think you'll see a lot of those themes reflected throughout the proposed action steps that you all came up with. And so as we transition into this next section, as Tarnisha said, thank you so much, everyone, just for the time, your expertise, your perspective that you all brought throughout this process. I think over the course of our meetings, we've had really thoughtful conversations around specifically how to access care, health literacy, navigation barriers. We talked a lot about communication that's culturally responsive, health literate, and then we talked about those challenges that residents continue to experience when trying to find and connect to services. And your feedback has really helped to shape the direction of this work. And so today is really just intended to serve as that final review and that final discussion of those proposed action steps that were tied to the goal and objectives that, we all selected together. And so we'll walk through these strategies one more time as a group, because I really just want to make sure that they still feel aligned with the priorities that we identified. I want to make sure they still feel realistic, still feel actionable, and to, again, just gather any final thoughts or refinements, because we're gonna write this final CHIP document and it's gonna be published. And we really also just want to make sure that we have the right partners identified to support this implementation. I know we talked about it a little bit in last month's meeting. But if there's any groups or any partners that we haven't thought of, any populations or pockets of people that we haven't thought of, then we want to make sure that we identify those to include in our action plan as well. All right, so with that, let's go ahead and walk through the proposed action plan together. And so starting with objective 1.1, again, we're aiming to improve awareness and use of Find Help as the centralized health information and navigation platform. And this first strategy area really focuses on coordinated community outreach and awareness. And so throughout some of our discussions, we talked about really just having a resource. We talked about how having a resource available isn't really enough if residents don't know it exists, if they don't feel confident using it, or if they don't trust it. And so these action steps really focus on coordinated outreach efforts with the health department, with community-based and faith-based organizations. We talked about trusted spaces, healthcare providers, schools, libraries, and other coalition partners to promote Find Help as the centralized place that residents can go to search for health and social service resources. We also discussed the importance of making sure promotional and educational materials are not only clear, but that they're health literate, that they're multilingual and culturally responsive as well. And because we know people access information in a lot of different ways, we wanted to consider strategies that were that varied in our approach. So some were in person, some were virtual. And so we talked about social media, we talked about online newsletters, printed newsletters, going out to community events to promote, websites, trusted messengers like our CHWs, like our healthcare navigators, and utilizing things like live demonstrations or tutorials. And the goal here really is, again, to increase that awareness, increase that confidence and comfort navigating these available resources. And most importantly, we're not just trying to measure these outreach activities. We also want to understand whether residents are actually becoming more aware and using this platform over time. So being able able to track that data is something that we're able to do within the Find Help platform. So I know that's a lot, but I just wanted to just kind of share that first strategy with you all and to gather any final thoughts on this section in particular. Any thoughts, any additional outreach partners or trusted community spaces that we could be considering here? And Sharon, I see your comment here about the baseline information on the number of organizations actively using Find Help. That is something that we would be looking to collect. And so if you all remember, we talked about, kind of in that first year, that's kind of like our baseline data gathering as well as like awareness. And so you kind of take that time in the first year to gather information like that, and then so that way we know which direction we want to go in the following years. So yes, that's something we would be collecting. I think I saw a hand. Sorry, I can't see all the icons when I'm sharing my screen. Was that
It's
Crystal?
me, Shanae. Yes,
Oh,
this is
perfect.
Crystal with WellPoint. So this is just regarding like public spaces where information can be shared. I was actually in my local grocery store the other day, and there was like a police officer just kind of walking around that we happened to know. He's a family friend, and we were talking to him. Anyway, he was doing like some part-time work in the grocery store, and a gentleman came up to him, asked him about shelter information, and he was like, "Oh, I think the grocery store has some stuff. Let me go get a couple flyers or whatever." And it was interesting because I had never thought that something like that would be a space where
Yeah.
somebody would ask for help. You know what I mean? So anyway,
Mhm.
that's a little random, but
No, I love
valid. I
that.
mean, it happened. So anyway, I was just thinking that maybe fire departments, police stations, things where people would go in and
Even
ask for
coffee
help.
shops.
Oh, I'm sorry. I didn't know if somebody else wanted to chime in too. But yeah, anyway, just sharing. That was an experience.
No, I love that. That was a very, very creative idea. Thank you for that. And I've
No
noted that
problem.
grocery stores, fire departments, police stations. Any other spaces we should be considering, or any other partners to help promote this message, share the message?
Um, this is Marlene, sorry, Orante from
Hi,
Hathaway
Marlene.
Center. Hi, how are you?
Great.
You know that we are here just to support you and help you in anything that you need about health literacy
Mhm.
and website to review all those tools and training your staff also. Whatever you need about health literacy, we are here. Yeah. Okay.
Yes, ma'am. I haven't forgotten you. Thank you, Marlena.
Our pleasure.
Awesome. All right. Well, hearing no others, let's go ahead and move on to our second strategy, which focuses on community access points and navigation support. And so one thing that this group emphasized throughout this process is that access to information also depends on where residents already feel comfortable seeking support. So again, that trust piece is really a huge factor here. And so these action steps focus on integrating Find Help into those trusted high traffic community settings. So like our WIC offices, the clinics, the library, schools, community centers. There was conversation about barbershops, hair and nail salons. Crystal, you mentioned the grocery stores now, so that's something else that we can add to this list. The police stations, the fire departments. And so we also discussed the importance of training some staff, training CHWs, health navigators, case managers, and the like, so that way they all feel comfortable helping residents use this platform and connect to services as well. Another major theme that came up was reducing barriers related to digital access and literacy. And so this is something that we could lean on you all, Marlena, for support and training. We also talked about making sure there's disability access, language access. And so the strategies that we talked about in this round really was expanding tools like, QR codes are great, but maybe we implement kiosks. Maybe we have people in person utilizing tablets or paper materials, direct links, staff-assisted navigation support. And again, I think the broader goal here is just trying to make health information and navigation support easier to access and easier to use, especially for those populations of people who often experience barriers to care. So it's making them aware, showing them how to access it, and then showing them how to utilize it. Any final feedback or additions to this section before we move forward?
We have here in the university a digital information training and program. So they train many people around Maryland about digital information, about many other stuff about digital. So I can connect with them and with you too to work directly together. And because we are working with them also.
Perfect. Awesome. I'm making a note of that now. Thank you, Marlena. Any other thoughts or feedback? So that is our first objective. And so now we're going to move into our second objective. And as a reminder, this was really what we're trying to do with this is increase the number of partner organizations. So the first objective was about the people. This one is about our partners and how they actively use Find Help as that shared resource and referral hub. And so throughout our conversations, there was strong agreement that, improving resident access also requires that stronger coordination and collaboration across organizations and across sectors. And so this objective focuses more on things like partner adoption, referral coordination, workflow integration. We talked a bit about sustainability and that long-term alignment across systems as well. And so with our first strategy, we have that partner engagement and training piece. And we want to try to onboard, remember, we're starting in-house first. So onboard our coalition partners first to use Find Help as this shared referral and navigation platform, provide that training, provide technical assistance, and then also provide some peer learning opportunities to strengthen that partner confidence and capacity. We also talked about the importance of when we're creating these peer learning opportunities, this is an opportunity to share best practices, to share lessons learned, talk a little bit about success stories and other implementation strategies to help strengthen this long-term adoption and sustainability across our organizations. And so overall, I think the goal here is really just, again, increasing that partner engagement, increasing their confidence in using this platform, and then that consistency in use and messaging of the platform over time. Any thoughts on this section? Partners we should include in our training efforts? Okay. All right, hearing none, we'll go ahead and move into our second strategy, which again focuses on, this is more specific to that workflow integration. And so one of the challenges that we discussed earlier on was that, things like referrals often happen differently across organizations, which tends to lead to that inconsistency or duplication for residents. And so these action steps, we're really trying to focus on supporting partners in integrating Find Help, whether that's in their intake systems, their referral pathways, maybe it's just their basic organizational workflow, their service delivery, and then implementing it on their websites. Find Help has like a little navigation bar that you can easily add to the website for anybody who visits your site. We also talked about the importance of maintaining accurate and up-to-date program cards and service listings. That's something that we heard across our residents and partners who work directly with residents is like, yeah, I'll go to this website and there was a number listed and I called the number and the number no longer works, or the email no longer works, or this person no longer works here. Now we're at a standstill, right? And so we wanted to be very intentional about making sure that we as a coalition are maintaining those accurate and up-to-date program cards for your organizations, so that way the information is current and accessible. And I think ultimately the goal here with this strategy area is to create a more coordinated and connected referral system across organizations. And so we don't just want to only focus on partner participation, but we also want to collect information, collect data on whether referrals are actively being made and actively being sustained through the platform. So any final recommendations or workflow considerations we could keep in mind here?
Hi, it's Tara from Mary Center. Let me put my camera on. I do want to add that we at Mary Center, we have taken the time to claim our programs on
Great.
findhelp.org and by claiming our programs means that, we've double checked and made sure that the services are accurate, the business hours are accurate, and whether we are accepting referrals through the helpline, referral submissions, which is an efficient process, but some of our programs wouldn't operate effectively through that. So just wanted to say that we've taken the time to create our organization accounts to cross-check and ensure that our information is accurate, including the referral
Awesome.
process.
I love that. And thank you for doing that.
Mhm.
Yeah, I think I remember doing it in a previous health department. It wasn't really a difficult process. It's really just making sure you're intentional about updating it. And so whether that's, as a coalition, we decide, hey, this is something we want to do biannually, we just take time and set a reminder for our coalition partners to just, hey, take 5 minutes, double check to make sure your business hours and everything are accurate. And that's something that we can do internally as a coalition to just ensure that our partners are keeping everything up to date. So thank you for sharing, Tara.
And I see a question in the chat. Thanks, Jessica, for sharing. She mentioned that Find Help is embedded in their EHR through which CHW make referrals. And so Wendy was asking what EHR can do that. I know here at the health department, we have Epic, and we have Find Help is integrated in Epic here at the health department. And I think I saw another comment. Okay, Jessica said MedConnect, but we'll transition to Epic. And Crystal, which EHR system WellPoint is using?
Ours is more of it's like an internal documentation system that's just unique to our organization. It's not like an Epic that a lot of different companies use.
Okay.
It's just like a health platform or some, I don't even know what it's technically called, but it's basic, but it's just for us. But we do have Find Help kind of, I guess, also embedded into it. So I can make referrals directly from the system. I can locate resources, make referrals, send it via email to a member I'm working with, that kind of stuff. And it tracks everything, and people above me collect data and they do what they do with it. But it is a really great system, and there's a lot of capabilities for what you all are looking for on your end as far as tracking and keeping the program cards updated. I think they have a whole team of people that reach out to all of the programs routinely, like every 6 months or so, and they say, hey, do you have any updates to your program? Is this all the same contact information? Like they have people that do that. So it's good. It seems to work really well.
Good. Thanks for
Wonderful
sharing.
feedback.
And
Yeah,
I
thank
see
you.
Tara mentioned that they use ECW. And I know Find Help is also integrated with CHRIS, the Maryland State Health Information Exchange. So there's some integration there as well. So we're really going to call on our partners to make sure that their information is in Find Help and also making sure the information is updated. And we'll be doing the same here as the coalition and the health department. So we're really excited about all of the activities and the goals. So excited about this partnership.
It's like
Wendy
we
has
just
another.
unconsciously identified additional partners to work with.
Yes.
Unconsciously identified them in the chat, because our ECW, we haven't figured out a way to make those systems talk.
Yeah, it's not easy sometimes. So, oh, okay. Yes, the ability to close the loop for healthcare providers is amazing. Absolutely, Wendy. So, that's what we want to aim to make sure that we close in the loop and the providers are getting the necessary information back regarding their patients.
I love all this feedback. Thank you all so much for sharing this. Awesome. All right. Well, hearing no other comments, we'll go ahead and move to our last strategy area. I feel like a cloud is coming in or something. It's getting shady. And so this squirrel brain, sorry, the last strategy area for our work group focuses on coalition alignment, continuous improvement, and sustainability. And so something else that we had strong agreement on in our conversations was that long-term success really requires that consistency across partners and systems. And it looks like with the ones who are here that we all have some type of integration with Find Help. So it seems like we're already ahead of the ball here. So that's amazing. And so really these action steps really just focus on aligning our partners around the messaging and the consistent use of Find Help. So if someone in your community says, hey, I need help identifying a resource for housing, hey, we use Find Help. Let me show you how to access this, how to search, and, just making sure that the messaging and the consistency is there. And not just within this work group, but with all of our work groups across the coalition as well. And with the Find Help system, we'll be able to track those utilization trends. We'll also look to gather feedback, not just from our partners, but also some residents who are utilizing this. We want to improve usability and accessibility over time. So if you all are using it and you come across, maybe there's an issue with, closing a referral, right? We want to make sure that we get Find Help in, that we can figure out how to problem solve. And so that way, if any of our other coalition members come across that same issue, we have that support, we have the answer to that problem. And then, of course, supporting that sustainability planning and resource development effort over time. And so I think one thing that is especially important here is, again, that we're just building in opportunities for this continuous improvement, not just implementing the platform, right? We want to use it, that's great, but we also want to learn from partners and those resident experience over time and adjust as needed. And so I really think that the broader goal here is, again, just creating sustainable, coordinated navigation systems that residents and providers can consistently rely on. And so, I just posed to the group again, does it still feel aligned with the direction that the group wanted to take? Any final thoughts on this last strategy before we move towards our final documentation? And for those who are unfamiliar, our OAP team is internal. It's our data team at the health department. So we can look to them for best strategies to collect feedback and things like that. Any other thoughts before we close this one out? All right. Well, hearing none, thank you all again for sharing your insight on Find Help. I'm going to be leaning on you all as the experts for this because we have other work groups and they're completely unfamiliar and they're eager to learn. And so we'll be sure to have some opportunities to cross-collaborate and to share user experience and things like that across work groups. So thank you all so much. And overall, I think what we've really outlined here with this particular action plan, it really reflects many of the priorities that this group specifically identified from the beginning. So things like equity, things like accessibility, that community engagement, and that stronger coordination across systems and across sectors and partners. And more importantly, I think these action steps really reflect the collective input and the recommendations that you all shared. And so again, today was really just about that final validation before we move into that final CHIP documentation and publication, which is really, really exciting. And so over the next month, we're actually going to pause our regular work group meeting. So there will be no work group meeting in June. And this is really so that way the coalition leadership can focus on drafting that document, finalizing, reviewing, so that way it'll be finished and published in July. So really, really exciting. We're almost there. So again, just thank you all so much from the bottom of my heart, just for your participation, for your patience, for your thoughtfulness throughout this process. And we are really excited to share more updates at our June quarterly coalition meetings. And we'll talk a little bit more about that in a brief moment. But with that, I'll open the floor for any last minute comments before I turn it over to AJ to share a few community announcements. So any last thoughts or comments? All right, take it away, AJ.
Thank you, Shanae. Suburban Hospital has shared their most recent Southern Maryland Older Adult Resource Newsletter for June. This newsletter includes upcoming and ongoing programming for Suburban Hospital, Johns Hopkins Medicine, Washington Metro Oasis, and other community partners. It includes a variety of resources and events focused on supporting safety, health, and wellness for older adults in Prince George's County. So we'll be sure to share this out after the meeting. Please feel free to review it and pass it along to residents, clients, families, or anyone in your network who may benefit from these resources. The next announcement is a virtual webinar hosted by EveryMind called 988, a deep dive for clinical integration and crisis response. This will take place on Thursday, May 28th, today, from 6 to 7 p.m. This webinar is geared toward healthcare professionals, behavioral health clinicians, care managers, social workers, nurses, emergency department professionals, and others involved in crisis response or care coordination. Participants will learn more about how to integrate 988 into clinical workflows, when to use 988 versus 911, and key considerations for referrals, risk assessment, and follow-up. CME and CE credits are available, and a registration link is included on the slide. Prince George's County will be hosting the third annual Multicultural Festival on Saturday, May 30th, 2026 at Fairwood Community Park. This event is free and open to the public. The parade begins at 10:30 a.m. and festival activities will run from 12 p.m. to 6 p.m. This is a great opportunity for residents and families to come together and celebrate the many cultures represented across Prince George's County. There will be live music, performances, a large kids zone, food vendors, art vendors, and other community activities. So please feel free to share this with your networks, especially families and community members who may be interested in attending. There will also be a re-entry housing resource fair on Friday, June 12th from 12 to 3 p.m. This will be held at the Bridge Center located at 5001 Silver Hill Road in Sweetland on the second floor. The fair will focus on re-entry friendly housing providers and housing options in Prince George's County. Returning citizens, families, partnering providers, and stakeholders are all welcome to attend. Lunch will be provided at 12 p.m. Remarks about the health department's re-entry housing program will begin at 1 p.m. This may be especially helpful for partners who work in housing, behavioral health, social services, reentry support, or care navigation. The next announcement is for Living Well Diabetes Self-Management Program. This program is for people with pre-diabetes or type 2 diabetes, and caregivers are also encouraged to attend. The program will be offered virtually from Monday, June 2nd through Monday, June 27th. Monday, June 22nd through Monday, June 27th, from 4 to 6:30 p.m. This may be a helpful resource for residents who are looking for support with managing diabetes, building healthy habits, and learning practical tools for long-term health. Send us upcoming events. Sure thing, Denise. To register for Living Well Diabetes Self-Management Program, participants can call 301-856-9643 or email wellnessinfo@code@pg.md.us. PG Healthy Start is also hosting a free community baby shower and resource fair hosted by MedStar Southern Maryland Hospital Center. This event will take place on Saturday, June 27th from 10 a.m. to 1 p.m. This event will be held at the Prince George's Sports and Learning Complex in Landover. This is a great resource for pregnant residents, new parents, families, and community members who may benefit from maternal and infant health resources. So please feel free to share this with your networks, especially anyone connected to prenatal care, family support, WIC, doulas, CHWs, or maternal child health services. Lastly, this is to save the date for the 2026 Walk to End Alzheimer's, which will take place on September 19th, 2026. Registration is now open and the link is included on the slide. This is a meaningful opportunity for individuals, families, organizations, and community partners to get involved, raise awareness, and support families impacted by Alzheimer's. With new treatments emerging and continued attention on brain health and prevention, this walk is another way to support education, research, and community connection. So please feel free to share this with your networks as well. And with that, I can turn it back over to you, Shanae.
Awesome. So much going on. So exciting. So exciting. And so one other thing, this is the last call. So if you have not done so already, please go ahead and scan this QR code. You can click the link once we send this out post-meeting to update your contact information for the coalition directory. I do just want to make sure, again, that we have this accurate record of our coalition partners, but we're also going to utilize this as a way to ensure credit is given to everyone who's participated in our CHIP development process. So we don't want to miss you. We want to make sure we acknowledge you for your participation. So again, please make sure you fill out this coalition directory survey. And are there any other partner announcements at this time? We'll open the floor.
Yes, good morning, everybody. Denise from Community Engagement. I have found a way how to send you all these we have quite a few training programs that's coming up in July. We have CompTIA Tech class coming up, Basic Computer Spanish coming up, HHA Spanish, QuickBooks, English in America. I'm trying to read everything that's on the calendar. We got quite a few. I did say QuickBooks, right? English in America. Yeah, we have several classes, training classes is coming up that if any of your clients or customers would like to join to take a class, you can also let us know. I will find a better calendar that's been sent to me because there's a little print and you can barely read it that's been printed out. I can send it to the group to you, Shanae.
Perfect. Yep. Send it to me and I can always retype it or something so it's easier for everyone to see. Thank you so much, Denise. Any other partner announcements at this time? And I do want to note there was a typo on the Living Well diabetes. It's Monday, June 22nd to July 27th. So that's on me. I'll make sure that's corrected before I send the slides out. Well, if anything comes to, I think I heard someone else.
Nope, I was just going to say again, I just want to reinforce what Shanae said. Thank you all so much for participating. This is definitely the work of the coalition, and we want to make sure that everyone gets credit for participating in this, acknowledging in our CHIP strategy development plan. So we really appreciate it. So we're so excited that we got your feedback, your input in the strategies and goals and developing the strategy. So next is the work, actually, getting busy and doing the work and having that tangible product and having the resources available for our residents to have access to and able to make sure that is legible and the information is available and that they're easy to access the information. So again, we really thank you so much for your participation, and we want to make sure that the residents are aware of all the excellent and valuable resources that will better their health and their social well-being as well. So again, thank you so much. We really appreciate it.
Yes, thank you so much. And kind of to that note, as mentioned earlier, we're not going to have a June work group meeting, but we have our June quarterly coalition meeting coming up. And so I think our max capacity is 50. And last time I looked at the registration, we were at 42. And so I know a few announcements kind of went out in the past about registering. So if you have not already and you are available and would like to attend, this meeting is in person this quarter. But again, this is just a great networking opportunity. We're going to share across work groups what everyone is doing for their action plans and then figure out how we can collaborate across the board with one another. So June 9th, 6 to 7:30 in person. A hot meal will be provided because I love to feed my people. So please make sure if you are available and interested that you come, that you register at using the QR code or the link on the slides, which we'll send out post-meeting. I'll try to send that out by this afternoon. And so that is for our quarterly meeting. And with that, I echo Twarnisha's comments. Thank you all again so much just for your continued partnership and engagement. We appreciate you all being here today and look forward to seeing you at our June quarterly meeting.
Denise has her hand raised.
Oh,
so
yes, Ms.
sorry,
Denise.
No,
Denise.
wrong button. Wrong
Oh.
button.
Okay.
I am so sorry. I'm like, oops.
All right, that's all right. Thanks, everybody. Have a great afternoon and a great
Have a
weekend.
great one all.
Take care. Bye.
Bye-bye.